Many people believe that the greatest danger of diabetes comes only from eating too much sugar or sweets. They think that if they avoid cakes, pastries, or candy, then the risks are under control. But modern research shows a different reality. Doctors are beginning to speak more and more about a hidden factor that quietly undermines health, something far more dangerous than an occasional piece of chocolate. It is not a medication, not a forbidden food, and not even a lack of exercise in general. It is a very simple daily action, a habit performed by millions of people around the world after meals without a second thought. At first glance it looks harmless, even natural, sometimes even recommended. Yet inside the body, this action sets off a chain reaction that silently pushes blood sugar higher, damages blood vessels, stresses the heart, and accelerates the complications of diabetes. The frightening truth is that this one habit can undo hours of careful planning, balanced meals, and faithful adherence to medications. One story illustrates this hidden danger clearly. A man in his 60s with type 2 diabetes kept a strict diet. He measured his sugar levels, visited his doctor on time, and followed all the rules he had been given. Still, year after year, his health declined. His blood tests showed rising glucose levels, his circulation worsened, and his energy fell. No one could understand why this was happening until one specialist asked him a single question: "What do you usually do right after eating?" The answer seemed too simple to be important, but it revealed the key. This daily pattern, repeated over and over, had been quietly sabotaging his health for years. When he changed it, his blood sugar began to stabilize, and his risk of complications fell dramatically. This hidden trigger is the reason why so many people with diabetes face problems even when they think they are doing everything right. It is a reminder that health is shaped not only by the big choices, but also by the smallest daily actions. And now it is time to uncover what this habit really is, why it is so dangerous, and what can be done instead to protect the body from long-term harm. Diabetes is often described as a condition of high blood sugar, but in reality, it is a much more complex and far-reaching disease. Elevated glucose is only the beginning, a surface symptom of a deeper imbalance that slowly affects every organ system in the body. Over time, the constant pressure of high sugar levels begins to erode the delicate inner lining of blood vessels, weakening arteries and veins and making them less flexible. This damage silently builds for years until it finally shows itself in the form of serious complications. The heart is forced to work harder, circulation becomes sluggish, and tissues throughout the body no longer receive enough oxygen and nutrients. The result is an increased risk of heart attacks, strokes, kidney failure, nerve damage, and even blindness. The fear lies in the fact that these complications rarely appear suddenly. They develop slowly, step by step, often without pain or warning signs. Many people live with the belief that as long as their blood sugar readings are not extremely high, they are safe. But statistics paint a different picture. Studies show that up to 70% of people with diabetes develop some form of complication within 10 years of diagnosis. This means that the majority of patients are walking on a path that gradually narrows, bringing them closer to outcomes that may permanently reduce their quality of life. The danger is even greater because people may think that by taking medications and following dietary advice they have already done enough. In truth, the disease is influenced not only by what is eaten or how often medicine is taken, but also by the repeated daily choices that appear harmless. It is often these tiny habits that silently accelerate the damage. The body responds to them in ways that are not immediately visible, but are deeply harmful in the long run. This creates a silent trap. Individuals believe they are in control, while beneath the surface the disease is advancing. The fear is real and justified, because the complications of diabetes are among the most serious in all of modern medicine. They take away independence, mobility, and in many cases shorten life itself. And yet, despite the seriousness of these risks, most people continue to overlook the small details that could make the difference between protection and progression. It is within these overlooked details that the hidden danger lies, waiting for the opportunity to turn a manageable condition into a life-threatening one. After a meal, many people naturally turn to behaviors that feel comfortable or even rewarding. Yet these very actions can create hidden dangers for anyone living with diabetes. The most common response is to seek rest. Sitting heavily in a chair or lying down on a bed after eating provides a sense of relief, but inside the body, it slows digestion, reduces circulation, and allows glucose to linger in the bloodstream far longer than it should. Instead of being transported efficiently into the cells, sugar remains elevated, forcing the pancreas and the entire metabolic system to struggle against an unnecessary burden. Another frequent mistake is reaching for a cigarette immediately after finishing a meal. For those who smoke, this moment often feels like the most satisfying time of the day. In reality, it is a double blow to the body. Nicotine constricts blood vessels, just as sugar levels are rising, compounding the damage to the vascular system and greatly accelerating the risk of complications, such as heart attack and stroke. What feels like a brief moment of calm becomes a direct pathway to long-term harm. Drinks are another overlooked habit. Many people choose strong tea or coffee as a way to conclude their meal. These beverages contain compounds that stimulate the nervous system and interfere with the normal absorption of nutrients. In individuals with diabetes, they can amplify blood sugar spikes, raise blood pressure, and create a false sense of energy, followed by a sharp drop. The cycle of stimulation and crash adds strain to a body already fighting to maintain stability. The tradition of dessert after a main meal is perhaps the most obvious mistake, yet it remains one of the most widespread. Even a small sweet treat can cause sudden and dramatic surges in glucose levels. For someone with impaired insulin response, this can mean several hours of uncontrolled blood sugar, leading to inflammation and oxidative stress that silently attack blood vessels and nerves. All of these behaviors share a common thread. They are familiar, comforting, and socially accepted. Families rest together, friends share coffee, smokers step outside, and desserts are offered as gestures of hospitality. Because they feel normal and even enjoyable, their hidden dangers are rarely questioned. This is why so many people, nearly everyone with diabetes, continue to repeat them daily, convinced they are harmless. Yet with each repetition, these common mistakes gradually add to the cumulative weight of the disease, moving the body closer to the very complications that everyone fears. Among all the small actions people take after a meal, one stands out as the most harmful for those living with diabetes, and it is also the one most often repeated. The simple act of lying down or remaining completely still immediately after eating feels like comfort, but inside the body, it becomes a silent trigger for serious consequences. When the body is placed in a horizontal or motionless state right after food intake, digestion slows dramatically. The muscles that normally assist in moving glucose into the cells remain inactive, and blood sugar stays elevated in the bloodstream for far longer than it should. This creates an extended window during which vessels are exposed to high glucose levels, leading to microscopic damage that accumulates with each passing day. Medical studies have confirmed that physical inactivity after eating leads to higher postprandial glucose spikes and delayed clearance of sugar from the blood. For a person with diabetes, whose system already struggles with insulin resistance or insufficient insulin production, this is particularly dangerous. Instead of gradually lowering sugar levels, the body is forced to endure repeated surges that strain the pancreas, the cardiovascular system, and the kidneys. Over time, these repeated stresses create the very complications that make diabetes so feared: neuropathy, retinopathy, kidney disease, and cardiovascular crisis. The deceptive part of this habit is how innocent it feels. Many people view a short nap after a meal as a sign of relaxation, even health. In some cultures, it is a cherished tradition, considered beneficial for recovery and balance. Yet for someone with diabetes, the reality is different. that 20 minutes of lying still, day after day, becomes a hidden accelerator of the disease. What seems like a harmless routine is in fact an invisible force that erodes long-term health. Real cases reveal the impact clearly. Patients who regularly rested after meals reported stable lifestyles and adherence to their medical routines, yet their test results showed uncontrolled sugar and worsening markers of inflammation. Once this single habit was identified and changed, many began to notice improvements within weeks by simply avoiding the urge to lie down and instead keeping the body active. They were able to stabilize their blood sugar more effectively and reduce their risk of complications. This first secret element demonstrates how a small daily choice, repeated without thought, can silently shape the course of a chronic condition. It proves that the difference between stability and decline often lies not in grand medical interventions, but in the ordinary patterns of everyday life. Beyond the danger of lying down after meals, there are several other habits that act as silent accelerators of diabetic complications, and they are so deeply woven into daily routines that most people never question them. One of the most damaging is the tendency to smoke immediately after eating. For smokers, this moment feels almost ritualistic, the cigarette that completes the meal. Yet inside the body, it is a toxic storm. Nicotine and other chemicals constrict blood vessels at the exact moment when glucose levels are rising sharply. The combination magnifies vascular stress, raising blood pressure, impairing circulation, and amplifying the inflammatory response that drives complications such as heart disease, neuropathy, and kidney failure. What feels like satisfaction is in fact a double assault on the body already struggling with unstable blood sugar. Another widespread behavior is the automatic reach for coffee or strong tea after finishing a meal. These drinks provide a burst of energy and alertness, but they also stimulate the nervous system in a way that interferes with glucose control. Caffeine heightens insulin resistance temporarily, which makes it harder for sugar to move out of the bloodstream and into the cells where it belongs. The result is a higher and more prolonged post-meal glucose spike. At the same time, these drinks can elevate heart rate and blood pressure, adding more strain to the cardiovascular system. For people living with diabetes, this routine cup of coffee or tea becomes far more harmful than it appears on the surface. Perhaps the most obvious, but still common mistake is the indulgence in dessert immediately after the main meal. Even a small serving of something sweet adds another sharp rise to an already elevated blood sugar level. For a person whose insulin response is impaired, this means that sugar can remain dangerously high for hours. Over time, this pattern promotes oxidative stress and damages tissues throughout the body. The pleasure of a sweet bite after eating is quickly outweighed by the long-term consequences it produces. All of these behaviors share a dangerous quality. They are normalized and even celebrated in social life. Friends invite each other for coffee. Families bond over dessert. Smokers take breaks together. And these actions are tied to comfort and connection. Yet in the context of diabetes, they represent hidden threats that quietly intensify the disease. The tragedy is that people engage in them without realizing the harm, repeating the cycle day after day. Recognizing these second elements is critical, because by simply removing or replacing them, the trajectory of the disease can shift. What seems like a harmless cultural or personal ritual is in fact a powerful influence over long-term health outcomes. When the harmful habits that follow meals are combined, the body faces a relentless burden that accelerates the development of complications. Lying down slows the natural movement of glucose into cells. Smoking narrows the blood vessels that should be delivering oxygen. Coffee or tea intensify insulin resistance. And dessert adds a new surge of sugar to an already strained system. Each of these actions is damaging on its own, but together they create a perfect storm. Blood sugar rises higher and remains elevated longer. Blood vessels become stiffer and weaker, and the heart is forced to work under constant pressure. The immune system and kidneys are placed under strain, and over time the body's ability to recover diminishes. What seems like ordinary behavior after eating becomes the invisible foundation for neuropathy, vision loss, kidney disease, and cardiovascular problems. Yet the reverse is also true. When harmful actions are replaced with simple beneficial habits, the effect compounds in the opposite direction. One of the most powerful changes is as modest as it is effective, replacing rest with a gentle 10 to 15-minute walk after each meal. During this short period, the leg muscles act as natural pumps, drawing glucose from the bloodstream into the cells to be used for energy. The result is a smoother curve of blood sugar rather than a sharp spike. Insulin works more effectively, circulation improves, and the body avoids the prolonged exposure to high glucose that causes damage. Studies have shown that even a short walk can lower postprandial blood sugar significantly, providing a protective effect equal to or greater than some medications. Real examples demonstrate how transformative this can be. Individuals who had long suffered from unstable sugar levels found measurable improvements in their tests within weeks of adopting the habit. One man who previously took a nap every afternoon after eating replaced that rest with a slow walk around his neighborhood. After 3 months, his HbA1c levels fell, his blood pressure normalized, and his doctor reduced the amount of medication he needed. The change required no special equipment, no cost, and no dramatic lifestyle overhaul, only a willingness to break with an old pattern and adopt a new one. The combined result of abandoning destructive routines and embracing supportive ones is more than the sum of its parts. Each positive step lightens the load on the body and helps prevent the silent progression of complications. Each avoided mistake allows the body to recover more fully after meals. Over time, these small daily victories accumulate into a measurable difference in health, energy, and quality of life. In this way, the ordinary moments after eating become the turning point that determines whether diabetes advances unchecked or is kept under control. The evidence is clear that a single daily choice after meals can determine the difference between stability and decline in diabetes. This moment, often overlooked, holds the power to either protect or damage the body. The message is simple but urgent. Do not allow small habits to create big consequences. Instead of lying down, instead of lighting a cigarette, instead of pouring a strong coffee or reaching for a sweet dessert, there is a different path that offers genuine protection. Choosing to move, to walk, to keep the body gently active, that eating transforms the way glucose is managed and reduces the hidden stress placed on organs and blood vessels. 10 minutes of activity may feel insignificant in the moment, but repeated each day, it becomes a shield against the complications that shorten lives and diminish independence. The call is not for extreme effort, expensive treatments, or complex programs. It is for consistency in the smallest of actions. A slow walk after breakfast, a light stretch after lunch, a few steps around the home. For dinner, these ordinary acts bring extraordinary benefits. Each repetition lowers sugar more effectively than rest, strengthens the heart, and preserves circulation. Every person with diabetes carries the choice within their reach, and the result of that choice will echo through years of health. It is also important to remember that awareness alone is not enough. Knowing the risks does nothing unless behavior changes. The danger of complications grows silently each day, but the opportunity to resist them grows just as silently with every good habit that is adopted. Those who take action today will see the rewards in greater energy, clearer thinking, stronger immunity, and a longer life with fewer medical crises. The path forward is straightforward. Recognize the hidden danger of harmful after-meal routines and replace them with actions that heal instead of harm. The final encouragement is this: begin now. The next meal offers the next chance. Stand up, take steps, and give the body the help it needs. Do it once and it feels small. Do it every day and it becomes transformation. Health does not only depend on medication or medical advice, but on the ordinary habits that shape the flow of daily life. In the quiet minutes after meals lies the key to whether diabetes will control the person or the person will control diabetes. Those who choose movement will choose strength, resilience, and protection for the future.